Good evening. If everybody could just finish filing in. I know we're already running a little bit behind schedule, and so we want to get started. Ladies and gentlemen, welcome. My name is Jennifer Hearn. I am the Chief Officer and Permanent Secretary in the Ministry of Health and Culture, and it gives me a tremendous amount of excitement and pleasure to welcome you tonight to our 7th annual Healthcare Conference. I need a little sign. I should have brought the, applause sign, so you cue applause, but anyway. It's fantastic to see everybody here tonight. This year's theme is Chapters of a Healthy Life, and if you've had the opportunity to review the conference schedule, you'll see that we have a fantastic lineup of speakers and a really diverse range of topics that we're going to be learning about over the next few days. I do have apologies from the Honourable Premier and Minister for Health and Culture, the Honourable Alda McLaughlin, and also Councillor Roy McTaggart, who is our ministerial councillor for Health and Culture. They had both hoped to join us here tonight, but unfortunately they are still in session at the Legislative Assembly. I think I can speak with a great deal of confidence when I say they would rather be here with us tonight. So I do have apologies from them. But I do want to welcome, we have a number of people that I want to acknowledge this evening. We have the Chairman of the Health Services Authority, Mr. Jonathan Tibbetts, who has joined us all the way from Cayman Brac. Thanks for making the trip, Jonathan. Well done. We also have the CEO of the Health Services Authority, Ms. Lizette Yearwood. Welcome. I saw the Chairman of CPAM, the Council for Professions Allied with Medicine, Dr. Clement von Kirchenheim, riding the back row. You trying to stay out of trouble, Dr. Clem? And I also saw the chair of the Medical and Dental Council, Dr. Sidney Ebanks. I spied him earlier. Welcome. Oh, there you are. Good evening. And Miss Andrea Dilbert, who is the chair of our Nursing and Midwifery Council, although she may not be in the room because she's part of our planning committee and is running around crazy trying to make everything happen. And I don't think I've seen Dr. Pomaris, who's the chairman of the Health Practice Commission, or Donald McLean, the chairman of our Pharmacy Council. But ladies and gentlemen, welcome. And also I want to say a big welcome and thank you to the members of our planning committee. You'll recognize them over the next couple of days. Tonight they're wearing their black polo shirts. Tomorrow they'll be in orange. And on Saturday they'll be wearing black again. But these are the ladies and gentlemen who can help you with anything you need. Maybe not anything you need, but most things that you need. So if you see them and you have a question, please ask the question. If you don't have a question, you see them, please say thank you. And actually, I just ask you if you could give them a round of applause now. And I also would be remiss if I didn't say a big, big hey to my Ministry of Health team, who I see riding almost the front row. Well done, guys. Thank you for joining us tonight. And I also want to welcome all of our speakers, our sponsors, our guests, and our delegates. You may have heard that we are expecting a record attendance at this year's conference. Last year, we had over 800 people, and we all sat back at the end and thought, wow, that was enormous. We'll never top that. And this year, we are expecting over 1,200 people over the next 3 days. So big round of applause for you for signing up and getting here. So this is the 7th year of our conference, and we're super excited to be here. We do have free Wi-Fi, which I'm sure everybody has been waiting to hear about. It is sponsored by Generali Worldwide, and if you want to access the Wi-Fi, it's Ritz Conference, I think, and the password is Generali, all lowercase, and if you need to find out how to spell it, it's on the program, and you can check it there. Speaking of wireless and phones, I would ask everyone, please take a second now and make sure that your phone is either on silent or turned off. All right? We don't want to disturb any of the speakers that we have up here. And as you were milling about this evening, you probably saw some of our exhibitors out in the hallway. Please do make sure that you take some time to go and check out all of them out. We've got some fantastic exhibitors who are supporting the conference, and you need to tell them thank you as well, because without our exhibitors and our sponsors, we wouldn't be able to offer the conference free of charge. So huge thanks to them. There's also a health check station, so if you want to check your numbers, you can stop by. Broward has sponsored that. And the Health Services Authority booth next door, starting tomorrow, you'll be able to get your flu shot. So please don't miss that opportunity as well. And you can also find out a bit more about the blood bank while you're there. And if you're ever running low on battery power for your phone, you can go to the tower booth to recharge your mobile device. So the first item on the agenda that you may have noticed was supposed to be remarks from the Honorable Premier. Now, as I've mentioned, unfortunately, he wasn't able to join us tonight, but I do have his remarks, and he has asked me to deliver them on his behalf in his absence. So good evening. I bring you a warm Caymanian welcome to the 7th Annual Cayman Islands Healthcare Conference. When I last checked, more than 12,000 people had registered for this year's gathering, evidence that this conference is just going from strength to strength. That's the largest registration of participants we've ever experienced in the 7 years of hosting this conference. As the Premier and Minister of Health, I am pleased at the increasing popularity of this annual conference, and it wouldn't be possible year on year without our sponsors who continue their commitment. I thank them for their continued support. I also thank and welcome our local and international healthcare providers who are giving us so much of their precious time this week. And those of you who are attending, I appreciate and thank you for taking the time to join us as we spend the next few days dissecting this year's topic, the chapters of a healthy life. As you participate in breakout sessions, various panels, and interact with our speakers and engage in audience participation, you will be probing the health issues of children, adolescents, women, men, and older persons. It's an interesting topic because I firmly believe that if we promote healthy lifestyles in our children, then they are more likely to keep up good habits like eating right and physical activity throughout their adulthood, lessening health issues in their older years. And speaking of health in older years, today is World Osteoporosis Day, dedicated to raising global awareness of the prevention, diagnosis, and treatment of osteoporosis and metabolic bone disease in both women and men. I mention this debilitating disease because studies have shown that things we do early on in life can help reduce the incidence of osteoporosis when we get older. Those studies have shown, for instance, that weight in infancy is a determinant of bone mass in adulthood. Physical inactivity and a sedentary lifestyle, smoking, and a high intake of alcohol all confer significant risks of future fracture. In the Cayman Islands, the top causes of death are cancer, cardiovascular disease, and diabetes. Again, all health issues that can be mitigated early on with healthy lifestyles that include the right kinds and amounts of food mixed with physical activity. For the next 3 days, you will hear from some of the most respected healthcare professionals in the world about some interesting ideas on improving health and thereby reducing costs. Cost to the healthcare system, cost to government, cost to the private sector, and cost to the patients themselves. You will find the speakers are as diverse as their topics. For starters, tonight we will hear from Caribbean Public Health Agency's Dr. James Hospitalis about goals for a healthier Caribbean region. Dr. James was key in starting the Pan American Health Organization program for prevention and control of chronic non-communicable diseases, such as those that we have in Cayman. And tomorrow, Dr. Verna Brooks McKenzie, a women's health consultant from Jamaica, who was practicing here in the past, welcome back, Dr. McKenzie, will speak on women's menopausal health. Dr. Brooks is a medical advisory board member for Red Hot Mamas. I was telling her I love that name, Red Hot Mamas, the largest menopause education program in the United States, providing midlife women health information and support. Following her will be Dr. Fitzroy Henry of the University of Technology in Jamaica. His presentation will focus on nutrition as the bedrock for a healthy life. Next on the agenda is Michael Reist, an author and educator with more than 30 years of experience in the classroom. He will talk about promoting emotional health in children and adolescents. Also on Friday, Sophia Chandler-Aline of the Cayman Islands Hospital will discuss the possible lifetimes of those who experience childhood trauma. Ms. Aline works in the Outpatient Department of Psychiatry and Behavioral Health Services at the Cayman Islands Hospital, where she holds the post of child psychologist. On her heels will be Chelsea Rivers, who will talk about the joys and challenges of raising a child with disabilities. Chelsea is a working mother who has fought for equality and fairness in respect of many social and environmental conditions, the most important of which has been the plight of the disabled. Friday's sessions will end with Dr. David Greenberg from the University of Toronto, who will discuss men's health guidelines and what he refers to as alpha males who don't think they need care. The Premier notes, I don't know any man who that would apply to. Saturday kicks off with Lois Tenenbaum, the founder and president of Homes Renewed, who will discuss aging, housing and care systems, transportation, and long-term care and health costs. Later, the focus for Dr. Colin Higgs is finding a new approach to increase physical activity through all populations. Following him will be Dr. Wael Barsoum of the Cleveland Clinic in Florida, who will focus on changing our lives by changing our behaviors. I think that by hosting this yearly event, it is evident that this government is committed to a healthy population. But we do more than just host this gathering each year. We put our commitment into action through policies and legislation. Just a few days ago, government unanimously approved the Solomon Webster's Disability Bill, which sets out a framework to prevent discrimination against those with disabilities, protect their rights, and promote their interests. The law underpins the government's disability policy, and the Cayman Islands are the first United Kingdom overseas territory to have bespoke legislation dealing directly with disability issues. At last year's healthcare conference, our own Dr. Mark Lockhart discussed the state of mental health in the Cayman Islands. And since then, an outline business case for a mental health facility has been completed that recommends a 42-bed long-term residential mental health facility be built in Grand Cayman to serve local and overseas patients with severe mental illnesses. The next step is for caucus and cabinet to meet and approve a site in the eastern districts, and the ministry is currently advertising for pre-qualification of consultants to design the facility, so the project is moving ahead. And once we have that facility, it will mean that those who require long-term treatment for mental illness will no longer have to be sent overseas and separated from their loved ones to get the care that they need. Hosting this conference is just another way to show our concern for the health and well-being of our people and our efforts to get as much information out there as possible to convince everyone to live healthy and smart lifestyles. As the Minister of Health, the Premier also has responsibility for the Mosquito Research and Control Unit, which is tasked with the effort to eradicate the Aedes aegypti mosquito, which carries diseases that threaten our health and our economy. MRCU is also working with scientists and technology to help rid the islands of the Zika virus by using genetically modified mosquitoes. This government is also taking steps to help promote medical tourism. Health City Cayman Islands has been at the forefront of this effort, not only for overseas patients, but has also proved important to local residents needing specialized tertiary care. And so with those few short words, I will close, as I know you are all eager to get on with the conference. Again, on behalf of the Honorable Premier and Councillor Roy McTaggart, we are happy that you could join us. And once more, we very much appreciate our sponsors. Having such a strong sponsorship contingent means we can once again offer attendance to the conference free of charge to the general public. And that results each year in our ability to fulfill our main mission, which is to reach out to as many of the residents of our islands as possible to help offer them solutions to improve their health and well-being. To each of the sponsors, on behalf of the conference organizers and the Ministry of Health, we offer our sincere gratitude. We also thank the public sector, the private sector, and the charitable organizations who have worked together to make this truly a collaborative effort. And for our visitors, we welcome you to the Cayman Islands and encourage you that while you do have a packed agenda and don't want to miss a thing at the conference, please take some time to enjoy all that we have to offer, from the pristine beaches to the wonderfully kind people. On behalf of the Honorable Premier and Minister for Health and Culture and Ministerial Councillor Roy McTaggart, we wish you all a very successful, enjoyable, and informative conference. Thank you. Next up, we have Dr. Darley Solomon, who is the president of the Cayman Islands Medical and Dental Society. Dr. Solomon was born in Georgetown, Grand Cayman, and received the majority of his education in the United States. He earned both his Bachelor of Science in Chemistry and Doctor of Medicine degrees at Howard University in Washington, D.C. He completed an internship in preventative and internal medicine at Bronx Municipal Hospital Center, New York, in 1995. He completed his general surgery residency at the University of Mississippi Medical Center and the Sonny Montgomery Veterans Association Hospital in Jackson in 2000. He previously served as Chief of Surgery at the Health Services Authority in 2004. Dr. Solomon obtained his Master's in Business Administration in 2006 from the University of Tennessee and he's been in private practice in Mississippi prior to joining the Chrissy Tomlinson Hospital staff in 2011. He is a member of the Mississippi State Medical Association, the American Medical Association, and the American Society of General Surgeons. He has served as the recent past chairman of the Cayman Islands Medical and Dental Council and is the current president of the Cayman Islands Medical and Dental Society. Ladies and gentlemen, please join me in welcoming Dr. Darley Solomon.
Good evening. I was checking off everything I was going to say during the minister's speech, so I don't have much to say. But good evening. Welcome to the 7th Annual Cayman Islands Healthcare Conference, Changes for a Healthy Life. And on behalf of the Cayman Islands Medical and Dental Society, I'd like to, first of all, give appreciation to the people that made the effort to plan and coordinate this conference. Thank you. Secondly, I'd like to express some gratitude to the presenters who have taken time out of their busy schedules to come to the Cayman Islands to share knowledge with us, as well as our local presenters who also will be contributing. In talking about chapters of life, it brought to mind a riddle. I don't know if any of you are familiar with Greek mythology, but there was a riddle posed by a sphinx. The sphinx was a winged lion, female monster that guarded the city of Thebes. And in order to get into Thebes, you had to get past the sphinx. The riddle was, what walks on 4 in the morning, 2 in midday, and 3 at twilight? And I can see some people chomping at the bit, so I know you know. A guy named Oedipus solved that riddle. Oedipus, some of you may not know, his name gave rise to the term edema, or oedema in the British language. So there's some medical connection there that's quite interesting. But he solved the riddle by coming up with the answer, and the answer was man. Because as an infant, man walks on all, or crawls on all 4. As an adult, he walks on 2. And towards the twilight of life, he uses a walking stick, or a 3rd leg. That walking stick helps to emphasize the frailty of life. And so, we're fortunate that during this conference we'll have some presenters who will help us navigate how to make some of the chapters of our lives healthier. You've heard about some of the topics concerning childhood issues, women's health, men's health, aging, physical activity. And I'm sure that we'll be able to take home some valuable information that can hopefully make our lives more productive, healthier, as well as having an impact on our community. The last topic of the conference is probably the most challenging. It's change your chapter by modifying your behavior. Well, we all know change is inevitable. Behavior modification, that's a bit more challenging. So if we can learn something from this conference, if we can take home even a small kernel to help us modify behavior, this conference will be a tremendous success. So once again, I'm looking forward to an informative and inspiring couple of days. Hopefully we'll all get something out of this. Again, my thanks and appreciation to everybody who put on went into the planning and coordination of this. Thank you, and again, welcome.